So, there is functional therapy, but is there optimal therapy? Registered Functional Therapists, RFTs, are a special group of occupational therapists, physical therapists, and other health professionals who have an extensive and holistic understanding of the human condition. Occupational therapists in particular have studied the human body and its conditions at the same level as physical therapists and also have extensive training in psychiatric conditions and task analysis. This training can range from ergonomics to education, from stroke rehabilitation to safe driving. This training is like an extensive toolkit they bring to each patient's condition and their particular situation. The CRAFT model is adapted from several occupational therapy models and philosophical frameworks and then reimagined to better explain it to the world. Most occupational therapists and all registered functional therapists are excellent problem solvers who bring lots of different perspectives to each health issue. The idea of the functional therapist is to bring you to a level that will allow you to proceed along your journey to optimal health. So you might not need someone who called him or herself an optimal therapist. Instead, a variety of people can be involved in mentorship and development of various aspects of your individual journey. The purpose of the functional therapist is to help you get to the point that you can take best advantage of that guidance. The trademarks for Registered Functional Therapist, RFT, and Registered Functional Therapy Associate, RFTA, are owned by the American League of Functional Therapists. I am the president of this organization, and you can learn more about us at www.functionaltherapist.org. When an RFT is consulted, they will determine what physical, mental, social, or motivational issues a patient needs to address. They will often try to find functional tasks that help you balance work, leisure, and self-care as you develop the abilities you need. They may also help you find supports to allow you to do more balanced activities. They will also consider your context of time, place, person, and situation to ensure that you are choosing solutions that best fit your needs. They are always aware that we are far more complex than the few basic therapeutic measures. We discover that the mystery of us, sometimes called the self or the spirit, needs to always be considered. As such, an RFT's intervention should allow you to move beyond survival through functional and towards optimal. RFTs can make excellent life coaches because of this ability to span the range of issues you may experience, and because they are excellent first stops in a triage approach to your care. They are also aware of the idea of optimal human potential and believe in it as being possible for everyone. There are so many choices from whom you could receive treatment. Registered functional therapists have an extensive understanding of the various disciplines, from alternative medical practitioners to the range of traditional care providers, from doctors, physician assistants, nurse practitioners and nurses, to occupational therapists, physical therapists, speech therapists, psychologists, marriage family therapists, social workers, home health care providers, and personal aides. Because of this understanding, RFTs can also fill this vital triage role. Figure 5.3, triage, assessment, analysis, treatment, or referral. On the bottom of this arrow going up is assessment, to analysis, to treatment, or to referral, to referral, to referral. Triage involved 4 main components: assessment, analysis, and then treatment or referral. The triage method is currently performed very well by a variety of practitioners, from EMTs and paramedics in emergency situations to general practitioner physicians. RFTs are excellent triage practitioners because many of the issues people face involve a combination of needs. Often the RFT is able to move through assessment to analysis onto the treatment themselves.